Hi, this is Urmila, the founder of Breaking the Silence Worldwide Foundation and the annual campaign that runs on social media throughout the year. On the occasion of the weekend, I take this opportunity to highlight a very important issue which is not being noticed and it is going unaddressed. Though there are 355 million menstruating girls and women in India, and when I talk about India, I also talk about girls and women around the world. Now, these menstruating women, a very minuscule percentage of them actually get hygienic and clean menstrual absorbents and sanitary products to use during their menstruation, and majority of them are using homemade materials to manage their menstruation every month. Now, the percentage differs in across different studies. There is a study in 2011 which claimed that only 11% of India's girls and women who are menstruating actually get to use sanitary pads, whereas others are just managing with materials which are available at home. And when I say materials available at home, they may not be hygienic and they may not be the right material to use, but because of circumstances, they are being used by girls and women. Now, this percentage increased over time with awareness and even with better studies. Recently, in the month of April, there was an article which said that around 36% of girls and women are using hygienic sanitary care products, whereas the remaining are still using homemade materials. Now, this is the situation of the health of India's girls and women. Though there are different criteria of assessing empowerment, and we see that literacy, education, and jobs and professions, women are increasingly taking up their roles. But when you look at the data and you find that actually women's health and materials for their health is not at par with how the rest of the world is accessing care, then we find that women are really lagging behind. Now, as per the Family Health Survey of India, there was a study which said that in urban parts of India, nearly 50% of girls and women do use the commercial sanitary pads. That still leaves 50% not using them. So we have different study. One study says that less than 20% of girls and women actually are able to use sanitary pads, whereas the rest are still struggling with homemade materials, and this is a reality. I'm someone who is not always relying on data and evidence from the government, because there are also gaps in these studies. Sometimes the sample size, sometimes the selection of urban women only. From that data, you cannot say that it represents the entire of India. And when it comes to Northeast India, these surveys and studies which are conducted in other parts of India seldom integrate the Northeast scenario into their study. So in the Northeast of India, we still don't know that how many percentage of girls actually have menstrual hygiene management products at their disposal. Now, this is a big lacuna and a gap in our programming, policy, and attention. And how is this particular need going to be addressed, and who is going to address it? Currently, sanitary pads are bought on the counter in the medical stores, pharmacies, utility stores, small-time shops, kirana shops, even malls, supermarkets, and a small percentage are being sold online by brands which have their websites and enable online purchase and delivery, door delivery. And many of these brands, I'm not sure if if they do extend their service to the northeast and other isolated parts of India. And then a small percentage is also being distributed by NGOs which are producing low-cost sanitary pads. Now there is also in some states government schemes where schoolgirls are provided with free sanitary pads, and this is also a very small percentage because we know that government schemes, there is a lot of pilferage in these government schemes implementation and material distribution. The government says that it is doing so and so, and a lot of money is being spent, but when I go on the ground, and if anybody likes to assess the reach of these government schemes in the grassroots level, we will find that they are almost not there. So this is the situation, and to think that the government schemes actually reach the last mile is a big assumption, and not just an assumption, but also it is dismissal of such a big need of 355 million menstruating girls and women in India. Now, I would like to give an example of what is the government schemes impact and reach. We know that the government departments do distribute condoms and also distribute oral contraceptive pills as population control and family planning measures under the ministry. However, how many of these actually reach out to people? And by people, I mean people like you and me. We always buy these products ourselves. These needs are always met by ourselves. We go and buy it. So that is the real scenario of how things really pan out for people. And the point that I'm trying to make is even for sanitary pads, it is eventually girls and women who actually buy it, or the families who buy it, and if they don't buy it, they don't have it. So we can't really rely thinking that government is going to have the last mile reach kind of a program. Now this is the lacuna, and this is where we have to function and look at the need. Now, Breaking the Silence Worldwide Foundation has been working on the field in the grassroots level since 2014. And this year in 2022, we decided that we are going to provide and distribute free sanitary pads to girls and women who live in poverty, who cannot afford to buy these menstrual products, or who are in communities which are isolated and are not being reached by any other program. And we do this not because we have endless resources or we have n number of pads. We are requesting our friends and supporters, and we are utilizing our own funds to buy sanitary pads, good quality sanitary pads, and we want to distribute it to girls who live in poverty. Now, I know no matter how much we try, we will not be able to reach many people, but this is a message which should go out to everyone, that NGOs, philanthropists, humanitarians, clubs, individuals, departments and organizations of all kind, they can utilize their resource, they can utilize their manpower and their programs and reach to distribute sanitary care products to girls and women in India, and not just once, but repetitively, constantly, and all throughout. So this is our work this year, and I request everyone to contribute sanitary care products of your choice to Breaking the Silence Worldwide Foundation, and our distribution drive starts on 28th of May in Bengaluru. Many organizations have reached out to me wanting to help in terms of material, in terms of human resource, and I'm looking forward excitedly to a successful program. And I plan to do it not just once, but all throughout till the time the economy improves and people find jobs and it becomes easier for people to buy sanitary pads. Now, all the percentage of users of sanitary pads that I just mentioned in the beginning of my Facebook Live today was pre the pandemic. The pandemic brought a new kind of complication because the menstrual products production and distribution was affected by the pandemic, like every other industry, and the supply chain management was also reduced greatly. In addition to that, people's paying capacity to procure these pads also reduced considerably, because for everyone medical care and housing became the most important area for using their money. So during pandemic, whatever the situation of sanitary pad utilization was there, it aggravated even further. This is the reason why I see a big humanitarian and health crisis for girls and women in India and across the world, which has been amplified by the pandemic and post-pandemic economic recession, which we are witnessing right now. And we cannot wait for the government to come and resolve this lacuna. It is a responsibility of citizens who are in a position to contribute in whichever manner. So I request each one of us listening to me to think about their own position to help, and either you can help us by giving us a material of your choice so that we can reach those beneficiaries and give it to them ourselves, or we request you to gift these sanitary care products yourselves to girls and women in your network and reach and in your life, so that they have clean hygienic material to use. Now you look in a situation where because of economic constraint, you don't have to buy something for your family. You can delay a haircut. Some people can even delay their education in the worst come scenario. Some people have resorted to just eating once a day, not taking the public transport, but walking instead. There are so many compromises that people are making because of economic constraints. But in the case of menstruation, a girl and a woman has no choice, because menstruation does not stop whether there is war, there is flood, there is conflict, whether a person is in a relief camp or a jail, institution, or even a pandemic. This is something that menstruators have no control over. So how does this crisis get resolved? And the answer is, we have to step up our contribution. Please be a part of our distribution drive and send us your menstrual care product of your choice, and we will deliver it to the beneficiaries ourselves. Now, the second aspect of our work this year is about highlighting the manufacturers, the users, and the menstrual products which are being developed and marketed in India, and which are of high quality, and they are doing great work. We want to be able to highlight them this year in depth, so that people have an idea about brands and products outside of those which are developed and marketed by FMCG companies. Now, every month, Breaking the Silence Worldwide Foundation is going to highlight one sanitary care product, one manufacturer and one user, via video interviews and infographic posts, and I hope you will benefit from them. And please participate by making a video of yourself as a user and sending it to me at urmilabtswf@gmail.com, and we will be happy to feature you as a user. And in this way, we can also get to know about the different products that people are using. Now, there was a time where only Whisper, Stay Free, Kotex, these were the brands which were in the market, but things have changed now and very good products have come. In the month of April, Breaking the Silence campaign featured Socyum reusable pads which are made of banana fiber, and it is made by an NGO in Kerala. And we also featured the positive aspects of this particular brand, and to me it was very enchanting, and I plan to use Socyum pads only going forward. We also featured the manufacturer, the managing director, an interview with her. Her name is Anju Bisht, and we also featured a user few days back who talks about her experience of using Socyum reusable pads. Now, these pads are unique because unlike other sanitary pads which are available in the store, like I will not name them, they cut trees to extract wood pulp out of which these pads are made, but Socyum reusable pads does not cut trees. It only uses the agricultural waste, the banana tree waste. After taking out the banana harvest, what is remaining of the banana tree, they use the banana agricultural waste to make these sanitary pads. These sanitary pads are made of banana fiber, and they are reusables. You don't have to throw them after using them. You can wash and reuse them. And when you finally are done with it, after using it for a year or more, when you throw it and dispose it, it is completely biodegradable, and it does not impose any harm or challenge to the environment when it is disposed. These are the plus points, and even for your pocket and the financial aspect is also in an advantageous preposition, because it claims that the investment in buying Socyum reusable pads is just 1/10 of what you would be utilizing if you were using the ordinary disposable pads. So I hope in the month of May you will look ahead to see which product Breaking the Silence campaign is going to feature. If you are a company, an organization, an NGO which makes menstrual absorbents, please reach out to me and we will be happy to feature you. The last thing I would like to share today is 28th of May, which is the International Menstrual Hygiene Day. We have two programs on that particular day. One is a mass distribution of free sanitary pads in slums, and we want to be able to give as many sanitary pads to as many girls and women who are living in poverty in Bangalore. So this is a great opportunity for you to get involved in this humanitarian work by donating menstrual care products of your choice to Breaking the Silence. The second program on Menstrual Hygiene Day is our bike ride that we hold every year to commemorate the International Menstrual Hygiene Day. And this year we are going to ride for a particular cause, and the cause of this year is to end period poverty. By this we mean the lack of menstrual care products that girls and women in India are facing with. The unaffordability, the unaccessibility, the unavailability of sanitary care products. This has to end, and different solutions have to be used so that period poverty is a thing of the past. And Men Take Lead Ride, the signature bike ride organized by India Bull Riders in partnership with Breaking the Silence campaign, will happen on 28th of May. We want your support in terms of sanitary pads we want to distribute, and I'm sure my friends will participate in this humanitarian cause. Thank you so much for listening to my Facebook Live, which was longer than usual, but I had so much to say. I hope you have a fantastic Sunday. I also thank all the donors the 6 donors who have contributed 600 sanitary pads packets of high quality, and now we have material for 600 girls. We need to step up this initiative, and I'm sure the people who are listening to will respond and help us in this. Take care and have a great day. Bye.